Hi everyone, it's Wellness Wednesday and we are back to discuss something really important, and it's called PMS and premenstrual syndrome. So we're going to be talking about this with Keith, Dr. Keith Berkowitz. Excuse my COVID hair again. Here we go. Let's get Keith. And we're going to be going over everything you can do to stay optimally hormonally healthy, and we're going to be moving into PMS to perimenopause to menopause next week, so stay tuned, all of you guys out there my age. And I'm experiencing all of them, Keith, and I just want to thank you for being with us today to discuss female issues, because you are, a lot of male doctors I find don't get it, but you really get it. I call PMS problem is a male species. That's my.
We always talk about what I told you about menopause men, right? Menopause, how menopause is a break for men.
Yes, let's pause for men. Okay, so let's go over PMS. Now, what is PMS? And let's go over the different types. We'll start with the general definition of PMS. Just get my supplements.
So PMS, otherwise known as premenstrual syndrome, is a disorder that happens before women has their menstrual cycle. And if you actually think of the menstrual cycle really in two or three phases. You have your first phase, and then in mid-cycle you have ovulation. So really between the phase of ovulation and having your period, most commonly a week before your menstrual period is when premenstrual symptoms really begin.
Hearing you with me for a second. Okay. And so why do some women get it really bad and some women don't have a problem with it? Lost my notes. Sorry.
So, well, first, I love statistics. Like, we'll start out with that. So
yeah.
I mean, they say 3 million people have it. I think that's probably a big underestimation. It's probably
more than
much higher than that. And typically, what we think of that, it's really a hormonal imbalance. A lot of times we talk week to week, it's about balance. And the hormonal imbalance typically is, in this case, is between estrogen and progesterone. And the reason why, we mentioned mid-cycle, which is ovulation, that's really where women begin to have their production of progesterone, and progesterone rises. Women that often have issues with progesterone production will often have more symptoms of PMS, because of what we call estrogen dominance or estrogen excess as being problematic.
Yes, and what people need to think about is hormones are messengers. So they're sending messages to your cells in your body to do X, Y, and Z. So if you're lacking in one particular hormone or have too much of the other, again, you're going to have that imbalance, that sort of symphony, the orchestra symphony. Fail. It's like going to be somebody playing off tune, basically.
Yeah. So the most typical reason why we see low progesterone, we've talked about this before. We talked about cortisol in the previous weeks.
Right.
Progesterone is one of the factors that produces cortisol. So when people have high levels of cortisol, progesterone says, hey, I'm going to work on stress. I'm not going to work on the sex hormone part. So then you do have that imbalance, and you have and oftentimes excess levels of estrogen and testosterone for that reason.
Right. And so for those of you out there that are listening in, we're talking about PMS and premenstrual syndrome. And what I'm going to do is I'm going to go over some of the symptoms so that you can relate if you've had it. I actually think every single woman at one point has had some of these symptoms. Mood swings, bloating, breast pain or tenderness, depression, tension or anxiety. So wake up in the morning feeling anxious, headaches, joint pain. So when you get out of bed, you're a bit sore, or if you're not moving for a bit, you get it's quite painful to move your joints. Sometimes you can feel that sense of social withdrawal and just want to cocoon and not go anywhere or talk to anyone. Poor concentration, which is another one. Irritability, also with skin. I see a lot of patients with acne, also rosacea. Either you can have an increased appetite or decreased appetite. It's one or the other. and some food cravings. A lot of the time people are like, oh, I know my period's coming because I'm craving chocolate, for example. You wouldn't know
Yeah, and
anything
so
about
also
that.
we talked. Maybe I do. Men
Maybe
have
you
maybe
do.
something
Men have
similar.
their own cycle, right?
100%. I'm convinced of that, and everyone around me is very convinced of that. So, so the other things also, constipation is a big one. You know,
Yes.
comes with bloating and sleep.
Yeah.
Sleep
Yes.
is a huge one as well too, where insomnia really kicks in. And what's
Yes.
interesting is people that have a family history of PMS, where if their mom had it or their sister have it, they're more likely
Yes.
to get it as well.
To get it,
So you
yes.
definitely see that family propensity to have that as well.
Yes, that's a good point. And the constipation is also looking at the thyroid hormones. A lot of the time, the thyroid hormones are off there, and we're going to be talking about like what's causing this PMS and what can you actually do about it, because there is something you can do about it. And so let's go into that. A lot of people with PMS as well, Keith, before we go on, they seem to have a correlation with depressive-like symptoms and also being on antidepressants. Let's talk about that correlation for starters, because anyone undergoing a lot of stress right now, which is a lot of people, their PMS symptoms are going to worsen. Is it the chicken or the egg? Which came first? You know, what's causing what?
So it's so interesting, you know, before I mentioned about how progesterone is your precursor to cortisol. And we talked about, when we talked about adrenal fatigue, high levels of cortisol really deplete neurotransmitters, your dopamine, your norepinephrine, your serotonin. Those are the really key factors in maintaining proper mood. So if you're having constant stress, those neurotransmitters are leaving the body very quickly, and you're going to feel more symptoms. And it can, what's interesting about this is often you can get anxiety and depression in the same day. So it can go back and forth, that it's not necessarily one or the other, but that irritability, the change in mood, and that can vary dramatically.
Right. So any boys that are watching, or men, if you have a sudden shift in your female friend, you know what it is, PMS. Okay. So is this, you know, we talked about like the genetic propensity towards getting this. So if your mom had it or your sister has it, you have a higher chance of getting it.
Absolutely. And also, you know, we always think about like people that we talked about insulin resistance, for example.
Yes.
People that have insulin resistance often will have higher estrogen levels, right? Fat cells make estrogen, and that estrogen excess really is a big contributor to premenstrual symptoms. So a parent with insulin resistance, whether it's male or female, could actually more likely produce a child with that same syndrome. And as they get into their 30s, 40s, and 50s, those become much more apparent. I mean, weight is a big issue. People, as they gain weight, that could be a trigger as well. That makes
it worse.
In a large
way. And we'll talk about like those food sources like sugar and all those things that make it worse. Okay, so what can we do? So we've talked about like describe some of the symptoms that go along with PMS. And so what can we do to actually treat something like this? I mean, I know naturopathically there is, I mean, I could sit here for hours, but we're going to just like break it down. Let's start with vitamin supplements. What vitamin supplements? And then we'll go definitely to diet. That's like the foundation. So let's start with supplements, just because I have them sitting in front of me here.
It's so funny. Every week, I think we talk about a lot of the same ones, right? It's very interesting.
I know
that they have the same effect. So the one we've been talking so much about is B vitamins.
Yes.
B vitamins really critical for maintaining, you know, proper menstrual cycle. We talked about B1 being deficient actually leads to more cramps, uterine cramps. So that is really important. B6, we've talked about neurotransmitter function. You know, B5 and regulating blood sugar, all those play major roles. Folic acid is a big one. And again, not only for maintaining proper hormone levels, but neurotransmitters. You know, remember we talked about how methylfolate and the methylated form of folic acid is so critical for dopamine, norepinephrine, and serotonin production, which is clearly impacted, you know, around your menstrual cycle, especially right before.
Right before. And we also have people with methylation defects, right? So the 5-MTHFR. So a lot of people are not able to metabolize a specific type of folate. And so taking folic acid or having green leafy vegetables is great. There is some risk and danger in taking folic acid, which we'll get into another time. But green leafy vegetables are fantastic. They're good for your, good source of fiber and a good source of folic acid. But some people that cannot metabolize are not going to get that optimal absorption, right, Keith? So, we have to look at giving people that methylated folate, the 5-MT-HFR.
And you brought up another great point about absorption, right? That's where proper digestion, again, we talk about how probiotics play such a major role. People with Candida or issues like that don't have proper absorption and will not make proper hormones. Sex hormones, like vitamin D, like cholesterol, are fat soluble. And we've talked about how complicated it is the body to use fat soluble when we talk about vitamin D. So that becomes an issue. So if you're resource deficient, your sex hormones will be deficient as well. And that's really critical. So maintaining proper digestion is so critical in this.
So critical. So we talked about the B vitamins. The one that I created is called Be Famous. And it has, for example, 100 milligrams of thiamine and then 50 milligrams of all the other ones, except for B12 as methylcobalamin, 250 micrograms. And then we have 100 milligrams of B5. And the reason why I up the milligrams of B5 is because B5 is quite deficient in people who are burnt out. Those who were with us last week talking about adrenal burnout and adrenal phase, this is amazing for that. And everybody that's taking, I'm going to give everybody a discount code at the end to get some of these. And I'm excited to say that they're going to be in, I can't tell you where, but they're going to be available in one of my favorite places for sale. And they've just taken them on. So I'm very excited. And you just take one a day with food. Never take it at dinner because they're B vitamins. You want to take it in the early part of the day, and one with food. And yes, your pee is going to be very yellow. And that's because of the B vitamins that you're excreting some of them. And whatever your body uses, they really like those, what you were talking about, B1, B6, and let's go to B5 and why B5 would be super important in PMS.
You said such a great point about, we talked about how regulating progesterone, how B5 has a big role in that, and also neurotransmitter production. And they all help regulate glucose. We talk about B12 all the time, and B12 affects oxygen capacity of your red blood cells. So if people get cramps, one of the main reasons where cramps come about, if you don't have enough oxygen transport to that part of the body, and that's really critical. And probably one of the worst symptoms people do get is the menstrual cramps right before their menstrual period.
And I love that you said that, Keith. No conventional medical doctor knows this information. I wish you would teach your colleagues, because you're such a wealth of knowledge, and like that kind of information is super key. There are so many people that suffer from menstrual cramps, and then once they start taking the B complex vitamins every day, their next period is completely different. And again, it's these deficiencies that we cannot get in food, sadly. So if we got these in food, it'd be a different story.
And there's a lot of thought that actually food is having the opposite effect, right? That we're seeing a real preponderance of estrogen excess or dominance through plastics, through estrogen foods. And again, you're seeing, because of that, probably more PMS than we've ever seen before, because of that excess estrogen that's in our environment. So again, cleaning that up and eating properly, digestion, taking the proper supplements is more critical now than ever before.
So I want to go back to some of the symptoms. So we talked about the B vitamin deficiencies and some of the symptoms like the neurotransmitter issues, so the depressive like symptoms that you get from these deficiencies. Let's move on to something like breast pain. A lot of women complain about breast pain, and it's sometimes unbearable for these women. Let's talk about some of the deficiencies there.
So two of the big ones we talk a lot about is iodine and vitamin E. Are two really critical ones we talked about. Iodine's so interesting. Years ago, we all learned that we were told to take iodized salt because we were so iodine deficient. And one of the thoughts behind that is that when they added fluoride into the water, it really is competitive with iodine. And unfortunately, we don't have a lot of great sources in our food supply for iodine. I mean, really the only one that's really tremendous levels is seaweed. You know, to have a lot of seaweed. But fish has some, but really not a lot.
Not that much.
And I think that, and what's interesting about iodine, and I've read an interesting study years ago, and I've seen this in practice, women that tend to get a lot of cystic breast tissue tend to have a correlation with low iodine levels. There tends to be really a direct correlation with that together. So, and again, the lower the iodine, the more likely they may see those fibrocystic breast tissue changes on mammogram or an ultrasound.
So that's why I created this. It's called Beauty in a Bottle. And it's not just for your hair, skin, and nails. It has the vitamin A, C, E, zinc, selenium, hyaluronic acid, iodine, MSM. And those combinations are super important for PMS. Even the vitamin A is super important for PMS symptoms. So
it's like the sex hormone orchestra.
It's the sex hormone orchestra. And it has chromium in it, chromium picolinate, which really helps blood sugar metabolism. So this is like a PMS goddess. Every time I have patients on this, they do extremely well, even with acne related PMS as well.
And again, you mentioned chromium. So although chromium is related to blood sugar, deficient chromium leads to more cortisol. So again, that's one. If I had to pick the enemy of PMS, it's got to be cortisol by far, right? That's our enemy. We're fighting up.
And
stress.
Cortisol is caused by stress.
So again, we want to have good cortisol, right? So going back to supplements, two of your favorites, we always have to talk about. Vitamin D is a big one. Vitamin D has a lot of impact on body aches and pain. There's really great literature out there talking about how people with deficient levels of vitamin D have to actually take double the amount of pain medication. So think about if you're going to go grab that Advil or Midol or non-steroidal when you're having menstrual cramps, having a low vitamin D may mean you have to take double that dose than you would otherwise. And then magnesium, your favorite. So magnesium. So we talked about menstrual cramps. Magnesium's a very critical one. Actually, and migraines, where migraines can happen as part of PMS too, and headaches. So it's so well known that actually when I was studying for my boards, one of the options for menstrual migraines was magnesium. So that's actually the test question. So even in the conventional literature, we now have recognized magnesium as being so important for blood flow and affecting, both headaches and menstrual cramps from that aspect. And calcium as well will have an effect on that with, blood flow and menstrual cramps in the same regard.
Absolutely. And it's important to get a vitamin D with K1 and K2 in it as well.
Can I add one more thing? I forgot. So the other one, the symptom we didn't talk about was leg swelling and fluid retention. And so that's where calcium, magnesium also plays a really important role in getting rid of excess fluid. That often happens, right before the menstrual cycle.
Even B6 does really help with water retention. People who are retaining water before their period. Okay, so we talked about that. The one thing that also I found is part of my toolbox to help patients with PMS is probiotics. And again, if you look at all the supplements I created, it's all around PMS because I suffered from it so badly that I had to I was like, I need this in my life every day. I need that. So I take my Beauty in a Bottle, Be Famous, Vitamin D, and Healthy Flora and my vitamin C cocktail every day without fail. And it makes me feel a lot better. The Healthy Flora probiotic that I created has got 2 strains, Lactobacillus and Bifidobacterium. And these are the Lactobacillus is a DDS1 strain, which means that it can survive the gut lumen and it can protect against any kind of acidity. And it's got 50 years of research because there's a ton of probiotics out there. And why I found this to be added to the roster of PMS is because a lot of people with Candida tend to get really bad PMS, and the Candida causes a PMS, and then it's like a vicious circle, a never-ending story. Keith, can you talk to us a little bit about that from your perspective?
Sure. So a couple of reasons it happens. Candida actually causes a lot of inflammation within the digestive tract. So what that's going to affect is absorption, and almost where your precursors where you need, and we talked about how sex hormones are fat-based and much harder to make. that's going to be affected by that. So, and typically people with Candida overgrowth will also have issues with cortisol. So they'll end up with high cortisol to try and compensate, and that will lead to even lower levels of progesterone. So that's a big one. And again, sex hormones, I almost call them our resources that when you need a generator, right? When you don't have enough energy, those are the ones that are pushed aside oftentimes because the body doesn't feel as most supported. So when it's fighting an infection, the body's going to say, okay, I got to take my resources from my sex hormone production and I got to fight Candida. So that will happen oftentimes. And then you'll see, more importantly, you'll see progesterone levels drop in that population, but also you'll see other hormone levels drop. It's really interesting. I'll have people come in with premenstrual symptoms and they'll do their blood test and their hormone levels are low. And they're like, how can I be estrogen dominant? How can I have improper levels if my levels are low? What we don't realize all the time, if your digestion's off, that may be affecting how your levels are perceived in the bloodstream. So poor digestion, and Candida being a great cause of that, will actually fool us and say, hey, you can actually have hormonal imbalance with low hormone levels. And we've learned to realize that and treat that.
Absolutely. And also, you know, Candida, people who have a high amount of Candida are producing alcohol-like substances in their body. So those individuals have like foggy mind, you know, have difficulty concentrating, and the Candida just causes all kinds of, a whole cascade of inflammatory responses that, you know, really do affect the PMS. And again, like you said, affect the hormone balance. And also it's a ratio, Keith, of estrogen to progesterone levels. So if you only test estrogen and say, okay, you're low in estrogen, what does that mean? Because you could be lower in progesterone, which therefore means you could still be estrogen dominant.
Right.
So
yeah, it's so interesting. And we talk about how there's 3 types of estrogen. So even using the word estrogen, probably in a woman is probably wrong.
Right.
So in PMS, we're really looking for estradiol. So we're looking at estradiol levels and seeing that versus progesterone versus testosterone and what kind of ratio they're in. And also what's important, what time of your cycle you're doing it with, because levels differ. If you're measuring your first half of your cycle, you're not going to see much progesterone because it's really not there. And I typically, because of that, will measure in the 3rd week around day 19.
Day 19, yeah, perfect. A lot of people don't do that. Again, this is something that I wish practitioners would do with their patients, is measure their hormones at the right time in their cycle. So when we're looking at progesterone, is progesterone, because progesterone seems to be one of the solutions to give patients like oral progesterone, you know, 50 to 100 milligrams at bedtime for people that are suffering with PMS, anxiety, estrogen dominant. How long does that last for? Because I see patients do really well on it initially and then it drops off again. Can you explain that mechanism?
So it's probably twofold. I mean, what's interesting is you can't give a lot because people don't also realize that progesterone also leads to estrogen production. So progesterone is also a precursor to cortisol. What I think is probably what happens is people are so depleted and they're maybe cortisol depleted that progesterone doesn't last to work as a sex hormone. That's going to be working on maintaining their blood sugar or, you know, on other factors where cortisol plays a role. So it may not work. And again, it's probably short acting, that it doesn't really last in their body very long. And I actually have some people that don't even tolerate low doses of progesterone when they have PMS because they're so estrogen dominant and sensitive that no matter what I give them from a hormone perspective, those estrogen levels do increase.
Interesting. And, you know, and that's why some people are like, you know what, I don't do well on progesterone, like, you know, and because it's converting. The key is going to be, guys, to fix your adrenal glands. And we talked about that adrenal gland last week. So if you didn't see it, you can go back onto both mine and Keith's Instagram because we've saved it. Okay, so we talked about B vitamins, B6, calcium, magnesium, vitamin D. We talked about probiotics as well, and vitamin D. There are some incredible herbs, incredible. Let's talk about those, Keith, because I've been using these in my clinical practice now for 20 years with amazing results.
So one of the big ones is chasteberry. We talk about that's used again for mood, to prevent headache, to prevent breast fullness and water retention. And again, I love this one because it comes from the fruit of a tree. So here's really a natural solution, as we say. Some of the other ones are, people use black cohosh. They'll use that to kind of reduce PMS symptoms because it helps support healthy progesterone, estrogen levels.
And estrogen
Sometimes
levels,
people are very estrogen sensitive, don't tolerate it very well. So that's one group that sometimes could be. There's also things like burdock. I don't know. I don't use that. Do you use that in your practice?
I don't, but traditional herbalists use burdock a lot. And, maybe it's something we need to come back to, Keith. I think we should look into that.
Because we've talked about how the liver works, right?
Yes.
It's working on, and again, the other one we talk a lot about that is things like milk thistle will also have that effect as well on actually clearing out the liver and getting rid of excess hormones that don't really belong there.
And in Chinese medicine, burdock cleans the blood, right? So it makes sense, that the blood is, slightly contaminated, like sort of toxic, when you're having bad PMS times.
Right, and again, so if you can balance out the hormones without having to take them, we always think of that being the best way.
This is the best.
That's why getting rid of what you shouldn't be there. Dandelion is one they is used a lot of times for fluid retention, and Dan Quai is another one that people use for menstrual cramps. I see for heavy bleeding, sometimes for headaches as well.
Yeah, and these sometimes can be put together in a formula. So look out for different formulas. I know, gosh, talk to your naturopathic doctor or a doctor like Keith that can give you a good herbal combination that's going to be worth it for you. Keith, what about, so those are the herbs and they work wonders. I know in some parts of Europe, like in Germany, black cohosh was the #1 treatment to treat menopausal symptoms. They don't even use hormone replacement therapy over there back in the 80s and the 90s.
Right.
I don't know what it's like now. Raspberry leaf tea and nettle tea, also very good. Those are really good for, women that are menstruating as well. Evening primrose oil, Keith. We didn't touch on that.
That's another one that we often use. People will actually help stabilize hormone levels. That's a good one as well. Absolutely.
Also prostaglandins, inflammation, really good at reducing menstrual cramping and also helping balance estrogen.
And what's interesting in the more severe version, which we call PMDD, that prostaglandin production is so critical. Where in that group, they have so much more inflammation, which is the prostaglandin response, and actually even a greater imbalance in neurotransmitters. So, we sometimes think of using more of that, anti-prostaglandin treatment in PMDD, which is the more severe version of PMS.
Why don't you describe what PMDD is for those out there listening?
So it's really, I almost think of PMS on steroids. So what it is in a way, it's just much more severe, where they're much more emotional imbalance, much greater, heavier bleeding, more menstrual cramps, severe headaches, where people in essence can't tolerate that 1 week prior to their menstrual period, and because it's so unbearable and often have to be medicated. And that's where a lot of the stuff where we look at serotonin comes in, and prostaglandins, turmeric, which really works as an anti-inflammatory, all play major roles.
And these are like people that are like having major mood fluctuations where they cannot. I have a friend, I don't know if she's listening. I told her we're talking about this. She has to like distance herself from human beings when she's undergoing this moment. She's like, I cannot be around human beings. My mood is just atrocious. And, it's really debilitating for her. And I said, you got to listen to this. We're talking about it today. The mood fluctuations are incredible, especially when you're under additional amounts of stress. PMDD can be quite debilitating.
It's so interesting when they've actually studied it. They looked at PMS versus PMDD. One of the things they found is a big predominance of very low serotonin levels. So in PMDD, serotonin was much more a problem, where it's much lower. And that creates a big issue. So looking at ways to actually supplement serotonin is so critical in that kind of aspect.
That's where I use a lot of 5-HTP and fish oil, because I do find that combination is really effective. along with removing food intolerances, because the inflammatory response with people eating those foods, I do find alter serotonin. So if you're eating cookies and sugar and you've got PMDD, stop it. You know who you
Or,
are.
you know what? We got to switch to turkey.
Yes.
So we
Switch
get
to
the
turkey because we
tryptophan,
get the tryptophan, right?
which is the precursor. And
Yes.
again, if you think about why it's so important, if you look at some of the antidepressants that are really used in PMDD, they really are working on serotonin. They're,
Exactly.
you know, the major class is the serotonin receptor inhibitor. So really supporting that's so critical in that aspect. And also from an inflammatory standpoint, it's really differentiating your oils as well, right? Omega-3 versus omega-6, using the anti-inflammatory omega-3s and really avoiding the more pro-inflammatory omega-6 oils, some of the vegetable oils we have in our diet.
Okay, so having more omega-3s, less omega-6s that are triggering inflammation. Also, we need to balance blood sugar. That's a big one for PMDD. That's why I said no cookies for you, PMDD group.
I have a patient I just talked to yesterday. It's really interesting. It's really interesting. She has such severe PMDD that I give her supplements for blood sugar stabilization. I actually have to stop them in the second half. I have to, because she can't tolerate it. Her blood sugar drops so low.
Drops so much.
So we have to, and that's really the challenge, because that fluctuation in blood sugar is really causing tremendous symptoms, especially panic, you know, and the insomnia, the anxiety, all those things are really coming off of that.
And so those individuals need to focus on good fat and protein. That is going to be your way out. I know it sounds, and water. A lot of people who have blood sugar problems are dehydrated. So
yeah, people forget when you have low blood sugar, one of the things your body does is it pulls water out. It's what we call an osmotic diuretic. So low blood sugar triggers more sweating, it triggers more urination, could be diarrhea. You're actually losing fluid. And what's interesting, what people don't realize, when you go to the hospital with blood sugar irregularity, what are the things you do? The first treatment is actually
hydrate you.
They hydrate you. They don't give you medicine.
No.
And that's what helps the glucose get back into the cell and be utilized in a more proper way.
Can you imagine if we said that, okay, guys, we have a cure for pre-diabetics, drink more water? Nobody would believe us. So it's as easy as that, guys. Drink more water.
It's too inexpensive.
Too inexpensive, and it doesn't make any money. Well, I don't know. Water sales these days are doing quite well. Okay, so we talked about the healthy fats, the omega-3s, eating more fish, more like a Mediterranean type diet, right, Keith?
Yeah, again, having heavy meats and stuff may not be helpful because it takes too long to absorb, where things like avocado, you know, sardines, the healthy things that are easy fats to utilize, really critical and really help dramatically stabilize your blood sugar.
What do you think about avocados in the FODMAP diet and people with SIBO? Because that's something that, you know.
I don't cut it out, but that's my personal opinion.
Me neither. I don't either.
If I had to cut an avocado from my diet, I don't think I could stabilize my blood sugar. That is like my go-to for stabilization. And again, what's interesting, there's not many other sources of high fiber that you can eat without feeling bloated. I mean, it's really unique in that form. I think I can't give that up, and most of my patients can't give it up either. So
yeah, me neither. And I tell patients with SIBO, I say, you know, listen, that's the one thing I'll let you have. And yeah, and it seems to be fine, but it's interesting it's on the FODMAP. Okay, we talked about tryptophan, 5-HTP, really important to be, if you have PMDD, you really need to be individually assessed. So, you know, we aren't your doctors, but we're definitely here to give you the baseline advice. What do we think about gluten? Gluten is horrific for
inflammation.
PMS.
That's inflammation on steroids. So that's the key. You want to avoid remember, inflammation triggers prostaglandins. That is such a defining factor in PMDD.
And there's so many other wonderful things besides gluten. You can get sweet potatoes, you can get brown rice, wild rice, quinoa, millet, amaranth. There are a ton. I don't know why we have to always go to this gluten. And even be careful about gluten-free bread, because there's sugar in there, there's junk in there.
And
yeast, which is, you know, like the whole thing with Candida. I think everybody has some form of Candida going on in their body. And it's about how your body calibrates and, you know, uses, because we have beneficial yeast in our body that we need, but it's when it grows out of balance that it becomes opportunistic, so to speak.
And Candida and gluten are so tied together. I remember reading studies out of the UK when they actually looked at molecular structure. There was so many similarities between Candida albicans, which is the most common, and what we see in gluten antibodies. So it's very hard sometimes to tell the difference between.
To tell the difference, because you're talking about gliadin antibodies and Candida antibodies, right? Like.
Correct.
Interesting. Okay. So,
I have one more treatment I learned about. This is new for me. You're going to be impressed. Aromatherapy, stress reduction.
What? I think, no, you know what? I honestly love aromatherapy. Tell us, Keith.
This is the first. You may never hear this again from me. So it was really interesting. Well, one, you know, I don't realize that I use it all the time, which is chamomile. So chamomile, I use.
Wait a second. You have chamomile aromatherapy in your room? Do you rub it on
Not
your
in that form. I use it as a tea, but that's okay.
Okay, fine.
But actually, the one I do use is lavender. So lavender I have used. I learned a lot about that. I put that on my forehead.
Give us your tips. Let's start with lavender. What are you doing with lavender, Keith?
Calming effect. You know, if you don't know, I have multiple teenage children. So, you know, there is high anxiety at home. So I use lavender. It's really effective. I rub it on my wrists or on my neck, and it actually has a really great calming effect.
I'd love to see this in action, by the way. That's why you're so calm.
You don't have to do it. We'd have to do it at the end of the show because I don't want to fall asleep during the show.
That's why you're so calm and you're such a good dad. I love every time I'm talking to you on the phone, I get to speak to one of your kids and you're just so hands-on. And you just rub some lavender and just have a chat with the children.
I should start rubbing it on them as well too. But,
that's a good point.
So chamomile is sleep.
Yes.
I mean, relaxation, sleep, so critical. Lavender. I mean, we hear so many studies on lavender and the calming effect. Clary sage, one I didn't know about before, for menstrual cramps. Neroli and rose both help reduce anxiety and stress. So there's really great options that, you know, and I think people always think of having to use pharmaceuticals, but there's actually options even that you don't have to take as a pill or as a supplement, but you can actually use and rub on your body. And aromatherapy is becoming bigger and bigger as a form of helping balance your body and really critically stress reduction and anxiety reduction, which no one has during COVID at all.
Absolutely not. I think we're under such high stress right now, everybody. It's just, I think these are really good tips.
I just found out my daughter, her college is now on 2-week quarantine because they've had so many cases. So here left and right between the White House, colleges around the country. So we need to really utilize as much stress reduction as we can. You talked about meditation last week, which is so critical. You know, that's another thing that helps. Doing things to help our body really stay in balance is, if I had to choose anything to do in the day, that would be the most important.
Oh gosh, I loved today. Today was amazing. Thank you guys for being with us for the PMS. We are going to take this journey along with us next Wednesday. We're going to talk about perimenopause and menopause and what you can do about it. Okay, so if any one of you guys are my age or above, you better join us. Be there or be square. Okay, thanks for joining us. Thanks, Keith. Love
Thank you. Have
always,
such a good day.
as always.
Thank you so much. I learned so much. Have a good day.
Okay, bye-bye.